welcome back to Sisterhood Redefined. We sometimes talk about hormones and how they affect our daily lives, but we rarely get a chance to delve deeper and understand what they really are scientifically and what we can do in our lives to help them work with us and not against us. In today's episode, I am joined by a functional hormone specialist, Dr. Olz. He has dedicated his career in helping women decode their bodies and understand hormonal health. So, Dr. Olz, before we delve deeper into this topic, can you please share with us what actually inspired you to go into the functional hormone space?
Thank you so much for having me today at Sisterhood Redefined. So what inspired me to focus specifically on functional hormone health? It was because usually patients would come to me with different hormonal imbalance symptoms, but then they did not know that it is the root cause was hormone related. And I saw that there was a gap, a misunderstanding, and as well as since it's functional hormone health. So I don't treat using drugs and stuff. I use functional supplements and managing and balancing lifestyle and diet, and also introducing other options, other treatment options to the patient and help them understand the bigger picture of hormones, because they would come maybe complaining about depression, but not really knowing that the root cause was hormonal based. So that's what inspired me.
That's really interesting because when sometimes a person is unable to sleep at night or has anxiety, and as just you mentioned, has depression, I would have never thought that it would be linked to hormones. But just as you just mentioned that sometimes and most oftentimes hormones are the root cause, I just wanted to ask, when patients come to you in the cases that you've mentioned and say, I'm noticing that my body isn't acting or isn't the way I normally know it to be, I'm not sleeping well, or I'm gaining too much weight, what is the first point of call that you normally use to diagnose? What hormones are you going to for that one?
So before we label it as hormones or hormonal, so there are about 7 processes or systems that govern our body, which is assimilation and elimination, which is your digestive system. So where your body breaks down food that you eat, absorbs it, and get rid of the waste. So before jumping in and labeling it as it's a hormonal imbalance, so I would first gather the data, both subjective data, that's the symptoms that the patient actually experiences, and objective data as well, the signs that they present with. And I take those symptoms and group them and see similarities or connection if they are connected. Because a patient would know that, okay, maybe a depression, with weight gain, it's a sign of hypothyroidism. So I would group those symptoms, similar symptoms together, and then I would come with a hypothesis. And then I would rule out the life-threatening factor, if those hormones maybe are life-threatening. And after that, I would validate the hypothesis, deducing from their symptoms. And I would create a personalized intervention that will have measurable outcomes. And since I mentioned that it's not just hormones, so we are governed by 7 systems, which is digestion, so how well your body digests and absorbs food; defense, which consists of immunity, and cellular communication, that's hormones and neurotransmitters. So I would say which system is imbalanced, or it's cellular transport, which involves cardiovascular system, the transportation of nutrients and oxygen to your cells, or like is it structural, like it involves maybe muscles, ligaments, or bones. So I would first then vet those symptoms against those systems,
Yeah.
and then deduce like hypothesis. Usually, what I notice with women when they come, uh, like for consultation, they almost always have like issues with their blood sugar like levels, or stress and
Yeah.
sleep,
Mm.
or like energy, like that involves like mitochondria, how well your body can convert glucose and oxygen into ATP if maybe that system is distorted, like as well as their cycles, which is governed by their female hormones, like
Yeah.
reproductive like hormones. And then I would also ask, when did they notice those changes? What is normal for them and what is abnormal, before jumping to like a diagnosis?
This is actually quite interesting, and I think I might need a consultation with you after this because we live in such a fast-paced world where fatigue is normalized. Like you go to like your 9 to 5, and there's a lot of deadlines to meet, so you assume that being tired is normal. Let me just quickly get an energy drink. But I never would have guessed that it has to do with all of these 7 systems that you've mentioned. And I think it's important that we're having this conversation so that we know what's really happening with our bodies, and if there's any challenges that are happening, we know sooner rather than later.